Thank you for joining us today on Living It Up, Making Life Juicy. And I am Ingrid. I'm your host today. And I have a lovely guest with me. She is a skincare professional and expert, and her name is Shawn Wiesen. How are you today, Shawn?
I'm great. Thank you for having me.
Absolutely. It took us a couple years to get together and do this
Only
show.
2. It's fine. We're finally here.
Yeah. So I'm sure you're all like wondering what this paraphernalia is, but and we'll get to that. But first, I want to ask you how you got into being an esthetician.
Very good. Yes, you did. I've been an esthetician for about 13 or 14 years. In the medical field for more or less 10 years.
Okay.
But yeah, I went into the medical side of things because I wanted to get better results for my clients and my patients.
Okay.
And I started working in dermatology, and that was really where I started really learning about the skin. And the dermatologist I worked for was wonderful. She taught me a lot. But again,
and this is where we met.
Right. I actually started in Philadelphia. Right.
Yeah.
And then I kind of worked my way through a couple different practices, got into plastic surgery as well. And I mean, the aesthetic career is wonderful because you do get to meet so many people, such as yourself. And I get to treat all kinds of different skin problems, aging skin, acne skin. It's great. It's a wonderful profession.
And who doesn't want to look younger, or if not, then at least your best, right? You just want to feel refreshed and feel great and know that people are seeing that from the outside.
And they're seeing the best you.
And this is for women and men, and I know that more and more men are becoming, tuned in to this kind of skincare as well. It's just, it's important, sometimes for careers, I hate to say it, but job ageism is still, sadly out there.
Sure.
So let's talk about looking our best, and let's see. I have questions all over the place, and this is ADHD right here. Okay, so
take your time.
When did the facility open?
Well, we're Mainline Institute of Plastic Surgery.
As you'll be seeing under the screen there with the phone number.
At the bottom. Right now I'm working for a wonderful plastic surgeon. His name's Dr. Ryan Hoffman. We are at Lankenau Hospital. We're affiliated there.
Which is right down the road from the studio here.
So it's on Lancaster Avenue. I've been with him. We opened our doors August 1st. And I've been with him since July. I've known him since March. I've heard about him for roughly 4 years. He came from a practice in Bryn Mawr. He's been kind of out there doing his best, doing great work on face and body for about 4 years in this area. And I'm really excited to be with him.
Nice.
I am. He's wonderful.
Nice. Yeah. So your title, tell us what your title is at the office.
Right now, I'm the patient coordinator. I'm also doing a lot of medical assisting at the practice. There's only 5 of us working there, so it's nice and small. We get to meet everybody, see everybody, get to know everybody. That's what I really like.
Yeah.
So there's no part of the business that I'm not in right now.
Super.
And also doing the medical aesthetics as well.
She's the queen of the office, so.
Well,
call her for Shawn. Oh, okay. So now what's the difference of going to a salon and having some work done as opposed to going to a plastic surgeon?
Not to, and as I said to you before, not to make light of anything you get done at a salon. Salons have a wonderful purpose. I am a hairdresser. I have been forever. And I put myself through college being a hairdresser. I did all kinds of skincare and spa treatments, which are wonderful. They're relaxing. They feel good. It's a wonderful atmosphere. The setting's wonderful. However, I wanted to see better results. I wanted to see my patients come in to me and know that I was working the best possible, with the best possible products to make their skin look as great as it could. And I think getting into the medical field is when I finally started coming across these wonderful chemical peels and microdermabrasions and laser treatments, and that's you can't get that in a salon.
Right, because they're really not licensed to do pharmaceuticals.
Right.
So, right, that's why I decided to
come on over to us.
See Shawn. Right. So, tell us about the products. Define an esthetician.
Okay.
Yeah, first, and then.
Well, there's two kind of categories of being an esthetician. You can be in the spas and salons, which you work with a certain grade of product, great cleansing, great moisturizers. There's wonderful products out there. However, in the medical side of that, so estheticians primarily take care of the skin. They're not going to do your nails. They're not going to do your hair. They're going to do your makeup. They're going to do your eyebrow waxings. They're going to do your facials.
Right.
The medical esthetician is going to take that to kind of the 10th degree.
Right.
So really kick it up a notch.
Yeah.
In terms of skincare. So you're going to see, oh, this brown spot that I've had forever. I've been going to my salon, and he's not getting rid of it. You'll come to someone such as myself, and then we'll work on that with either chemical peels, microdermabrasion, laser treatments, possibly even the doctor writing your prescription for a skin lightener or a Retin-A or something like that.
Yeah.
So really, it's taking it to the medical grade of skincare.
Right.
And all the products then fall under that medical umbrella.
Wonderful. Wonderful. Okay, so why did you get into this profession? We don't have the before and after pictures.
Yes, we don't. I have.
Sorry,
I wasn't always as beautiful. However, when all growing up, my father says, I think you were born with a pimple. Every single picture from the time I was in second grade till the time I was in college, I have acne. Every picture. I used to have to put two sets of foundation on. I had redness. I had rosacea. I was puffy and swollen because of acne.
Now, would you ever know it now? No.
Let's hope not. But so growing up that way, it was, I didn't go to the prom because I had acne on my face, back, and chest. I was embarrassed. I felt like everybody, they didn't see me. They only saw my acne. And
what a horrible,
yeah,
oh my God, especially at
I
that
had glasses, braces, and
oh God, honey, I'm so sorry.
Needless to say, I was not a happy camper for the most of the part because my acne ruled everything I did. If I had bad pimples, I didn't go anywhere. If my skin was a little better, maybe I'll go out. I was embarrassed all the time. Don't touch my face. Oh my God, don't touch my face.
Imagine.
So I think more getting into
especially
this profession.
As a teenager.
Yeah. And that's why I think my personality is. I try to make jokes about everything because I joked it all away for so long.
Yeah.
But getting into this is more of like an obsession than a profession. So I love meeting the teenagers who do have skin issues, and being in the medical field now, I have so much in my arsenal to help them.
To really
I
make
went
a
on
difference.
Accutane myself, which is the most heavy-duty acne medication out there. So that was my choice. I still think it's a wonderful product, and that if you do have chronic cystic acne, that you should go on it.
Wow.
However, there are certain things we can do in the office too.
Nice.
Yeah.
Like what?
Obviously chemical peels, glycolic acid, salicylic acid. There's all kinds of different combinations. There's different companies who are looking into making their skincare lines better to suit problematic skin. So we've got chemical peels. We do a lot of microdermabrasion. There's a lot of specific lasers that target just acne.
Yeah.
So we've got a lot of things that we can do now that we don't have to go all to the medical, to medicine and topical things and prescriptions that tear the skin up. And so we've got a lot of things that we can do in the office.
Nice. Nice.
Yeah.
And right down the street from Radnor Studio 21.
Yes.
We love that.
Yes.
Where do you see the office that you're with? Where do you see that going?
I mean, I guess the dream is, really the sky's the limits because we've got a fantastic plastic surgeon. He's young, he's innovative.
And his name again is?
Dr. Ryan Hoffman. And Dr. Hoffman is a great, he's willing to do whatever. He goes the extra mile for his patients. And I've only worked for him for a couple months now, and I've already seen what he does in terms of how he cares and, oh, this patient's been through enough, we need to help her out, especially with reconstructive surgery for mastectomy patients, cancer patients. So he does it all. We do a lot of great reconstruction and also augmentation, of course. Rhinoplasty, so the noses, the facelifts, the body does amazing body, tummy tucks, all that, ladies.
Thighs.
Yeah, hello, hello. Yeah, if you want any of this and this taken care of, he's fantastic.
Wow.
Yeah, so I think it is the sky's the limit at this point because we are just going out on our own and opening a new practice, and so I think anything's possible.
And also, I mean, not to put down, but there are more serious, not to put down this, the fun side of it.
Yeah,
but,
absolutely.
There's also the very serious side of it, of the people who really need a reconstruction or have been in accidents and really need to.
And are dealing with true, what they feel is ugly, what they're dealing with, especially post, everything they've gone through with cancer, losing your breasts, and then having someone come in and tell you that you can look beautiful again.
Yeah.
I mean, you can't put a price tag on that, you know?
Right. So, now let's get down to what all this stuff is.
Yes. When I started out in the medical field 10 years ago, I got my hands on glycolic acid for the first time in strong doses to resurface the skin and really kind of bring out the beauty of the skin, because there's healthy skin under there somewhere. A lot of patients don't know that they have to do chemical peels to exfoliate the skin, to protect the skin, nourish the skin. So I think that a lot of patients miss the boat on going to, the CVS's, not that there's anything wrong with that, and getting, the whole wall of, the whole wall of products that you go, I think SPF 150, it can get very, it's a nebulous and confusing thing. Yeah, what to get, what's right, what's good. I think in every esthetician out there will have their have-tos, their must-haves.
Right. So Shawn is going to give us a list of mandatory things that we need to have in our cabinet.
Well, when you open your medicine cabinet, there's a couple things you should see, or you cleanse.
Perfumes.
Or a cleanser in your shower, or what have you. Body wash, obviously, I always say is body wash, neck down. You want to treat the face, the neck, and the chest as if it's, a whole different being than your body, than your arms and legs and back. You want to make sure that you're cleansing, toning if you like if you like toners, not astringents that strip the skin, toners that help balance the skin. So I always tell patients cleanse, tone, treat, and protect. The treatments that I recommend if you're worried about brown spots, so hyperpigmentation, we're looking to do, a prescription's fine, hydroquinone's fine, but vitamin C in your medicine cabinet, your Skin Ceuticals, Skin Medica, what other one do I like? Obagi. They all have, and Glytone also has wonderful antioxidants. So you hear that catch word, antioxidant. I have to have an antioxidant. I think if you're missing an antioxidant, you're doing your skin a disservice. Whether it's vitamin C, vitamin E, or any of the other alphabet. Green tea, all those, red tea. It should be in your step. So lightening the skin, brightening the skin.
It's not enough to just ingest these things.
Because what you put in there does work its way out to the skin, because we are what we eat, of course. But what's in here and in here also manifests on the skin. So your anxiety, stress, stress pimple.
I got the stress
Yeah,
pimple.
or the period pimple, ladies, you know, or just straight out acne. So my must-haves are the Glytone line. They have wonderful products, and that's kind of what we did here. Glytone is chemical peels that I work with. I'm also a trainer for the company, and I absolutely love, love, love their peels. They go to the deep issues in the skin.
And guess what? She's going to do a peel on me.
I'm going to do a real quick peel on Ingrid today.
So she's going to take off all the camera-ready makeup and just lay it out there.
But yeah, so the vitamin C's, Glytone has a wonderful red tea line for antioxidants. Obagi has a wonderful vitamin C line, so does Skin Medica and SkinCeuticals. Your cleansers, it's not that I don't care what you're washing your face with. Obviously, I do. I want you to get your makeup off. I want you to wash your face twice a day. If you have problematic skin, there's all kinds of things I can help you with in terms of acne or anti-aging. But cleansing the skin is your first step to getting, you know, the crap off from the day, you know, at night. So
what do you think? We get started.
That's fine.
Here.
That's fine. Yeah. Yeah.
Okay.
Okay.
All right.
Hold on.
So,
I'm kind of
here
hooked
we are.
in. I'm hooked in. So I'm going to quickly cleanse Ingrid's face.
Where's my,
Am I okay standing like this, I guess?
Yeah.
I'm going to quickly cleanse your face.
Okay.
She's going to put her headband on, revealing the full face. There we go. There we go. What we have to work with. Chemical peels, it's always appropriate to protect your hands, obviously. So I'm going to cleanse your skin really quick with this cleansing pad. This is also from Glytone that we love, love, love. And we're doing kind of a halfy, because I want to leave her eye makeup on.
Right.
And the funny part, I think, about all of this is even when patients come in and I show them what I've gotten off their skin, you know, if I've microdermed their skin, and I say, oh my gosh, look, you know, it's not that you're not cleansing your face appropriately at home. It's just that you can't. You can't do what I can do in the office for you.
Right.
You can't exfoliate at home like you can with a chemical peel or a microdermabrasion will do for you. So that's our cleansing step. The next step is to do our prep step.
Which is what?
This is medical grade acetone. Don't do this at home. Don't get your nail polish remover out and think, oh, I'm going to scrub my skin. It's not the same thing. Not the same thing. This is just to what we call degrease the skin, get the fatty layer off the skin, to get the oil off so that the peel goes deeper and penetrates more evenly.
Good. Good. Do it, baby.
Now, 2 years ago, I treated Ingrid's skin, and we did a wonderful job. However, she has been a bad girl. She has not been back since then. So this will be, what is this going to be? The first of? Many. Yes, many peels to come. I like my ladies that, you know, want to come in and get treatments. I prefer you coming in once or twice a season after you've gotten a peel, okay? If you've gotten a peel series and you're doing great and you're taking care of your skin appropriately, I want you to come in once or twice a season to continue that peeling, because the skin changes with every season. We all know. Dry in the winter, oily or sweaty in the summer. It is what it is. So each season, as the skin changes, I want you to take care of your skin.
And what are you doing now?
This is actually the peel.
Ooh.
And they do these awesome peels in these ampules so that you can just put them right on.
Exactly what is the peel?
This is mandelic acid. It's a very gentle peel for skin who has not seen a peel in 2 years.
I know.
Or has not seen a peel ever. It's a perfect way to start. Patients don't like pain. Shocking. Nobody likes pain, I guess. So we won't talk about the people that like pain. But But yeah, we do these peels in the office, and a lot of times this is the best way to start out someone on a peel is to do, obviously I'd be laying this patient down, we'd be cleansing, I would be prepping appropriately, we're in front of a screen, we're doing this kind of on the fly right now. So that's the peel on the face. We would leave that on anywhere from 5 to 8 minutes. So this is like a cooking show. It's as if 8 minutes went by, and we're pulling it out of the oven, and I'm going to now neutralize her skin. So this is the neutralizer. It's
so
specific.
How long does
this stays on anywhere from 5 to 8 minutes, Mandelic peel. All peels are different. Some peels only stay on for 3 minutes. Some peels stay on for literally 2 minutes.
Okay.
And really what I always say is, let's talk to your patient. If the patient's feeling like, ooh, this is hot, you want to neutralize it. You want to look at. No.
I'm not feeling it.
No, the Mandelic peel is it goes deep into the skin, so you're not going to feel much on the surface. Some patients tell me they feel it when I put the neutralizer on, more so than when I actually had the peel on the face.
Huh.
But the Mandelic is a great way. This is like the party peel. You can
The
go,
party
yeah,
peel. I
you can
love
go
it.
right out to some event. You can put makeup on. They recommend you not wash your face for 12 hours,
So now this is a good thing to know also. So you don't wash your face.
Yeah,
and what
no
else?
water, no water on the skin for 12 hours. However, this
Okay.
is one of the most mild peels. I've put makeup on myself right after doing this. The skin looks tight. It glows. Patients love it. Love it,
Good
love it, love
for-
it.
yeah, for
Yeah, parties. You're not going to have any
weddings.
craziness look on your way out.
Yeah.
You're just going to have a nice, fresh, glowing appearance.
So maybe the deal is, and I don't want to, I'm just suggesting, I certainly don't want to take away business from salons, but maybe the deal is for a wedding to go and see you first and then go to the salon and get the hair and makeup done.
We treat a lot of brides. I never recommend anybody doing anything with a chemical or any waxing or anything like that. I keep looking up at myself.
Don't look up at yourself.
Or any kind of waxing on the day of the wedding, because you're looking at causing issues that nobody wants a burnt bride.
Right.
Nobody wants to see a burnt bride. So yeah, maybe 2 weeks prior to freshening up, getting a nice glow. The skin looks wonderful. Your makeup goes on wonderfully because of it. What I'm putting on, I love the Aven line as well because it is.
Let me see. Can I
Almost
see
has
this bottle?
no. You probably have seen the Aven.
yeah.
It almost has no ingredients.
Yeah.
It's like 6 ingredients
I
total.
can't see that.
But yeah, the Aven
That's
line
nice.
and Glytone are kind of a married set for me. We're going to put this moisturizer on.
And these are just products that you,
Over the years.
have discovered
Yeah.
work the best.
And even when I've gone to other products,
Yeah.
I always come back to them for the last 10 years. Even when I try, reps come in to see me, they want me to
Sure.
try their
And
stuff.
you have to.
And I have to make
Such
sure.
a problem.
Yeah, awful. Yeah, but I have to make sure I'm kind of on the cutting edge of new ingredients and new products.
Sure.
And have you heard of this? I hate saying, oh no, I never heard of that. What's that? To a patient,
Yeah.
And this is just SPF, obviously. We're going to protect. We always protect the skin.
I know Vogue and W Magazine and Elle and all those, big magazines are always have articles about what's up and coming.
Well, don't forget, a lot of those articles, they're
Are-
paid to
right,
be in
right,
there.
right, paid ads, yeah.
So New Beauty, everybody takes out a page and an ad.
Right,
Because
right.
they want to be the next best thing,
Right. And yet it's still your job to be up on it and know.
It's still my
Yeah.
job to make sure that I got into this not to hurt anybody. You know what I mean? I got into this to help people. So if I don't know what's out there, and I don't know what my patients are using when they go home
Right.
from my practice, it does make life a little bit more difficult because I insist on my patients being on the skincare that I've put them on, especially when we are treating you in the office. If I'm treating your skin in my office, that means it's 50% me and 50% you at home. So once I stop treating your skin on a bi-weekly basis or a monthly basis, and you're going to those more, every once or twice a season,
Yes.
that's when it's 80% you at home doing the right things for your skin, and 20% me doing the maintenance for you in the office.
Okay, so backtrack just a little. So I just had this done. When would be the best time for me to go in and have the follow-up, or
2 weeks.
You know,
2 weeks.
2 weeks. And then how long does that go on for?
So we usually do anywhere from 4 to 6 treatments, spaced every 2 weeks apart, and that's for, you know, your initial, like if it's been over a year since you had a peel, go in and get a series of 4 to 6 treatments. Then you're back on the road to making sure that your skin's going to be the best it can be. It's going to look healthier because you're getting off the stuff you can't get off at home. And as we age, our skin cells stop turning over as fast for us.
Oh, we don't like to hear that.
Yeah, so that stuff's sticking longer. So you want to come in and get exfoliated off and then protect the investment that you've made. So that's why the skincare at home has to be right.
Nice. So we've got about 4 more minutes. And
so what should we do?
Now, after you've done, okay, so pretend I'm the, well, okay, so this is my first treatment in a couple of years, 2 years. And would you do the same products, or would you get a little
No, I would
stronger?
probably, it depends on what, you know, oh, I haven't seen you, say you're a mock patient. We've treated your skin. I haven't seen Ingrid in 2 years. I want Ingrid to come out, you know, you need to get back on the bandwagon with me. You need to do the right things. We need to get your skin in working order. So you're going to come in. We're going to get you set up with your products. Typically, I sell packages of treatments together.
Nice. I like that.
Then we add in some product in your package. So it's a one nice deal.
Right.
So you're paying for your full kit of product and your services. And since you're paid in, you're paid in.
That's great.
You know,
I like that.
you're paid in. You're ready to commit. So you're going to come in those every 2 weeks, and usually I'll set up every single appointment with you from start to finish, and then I'll set up at your 4th or 6th treatment. We'll set up for I'm going to see you in 2 months.
I got
and
it.
it's going to be 1 treatment every 2 to 3 months.
Good.
So that you're on that maintenance.
Nice.
Yeah.
And the skin is the biggest organ of the
gotta
body.
take care of it. We have to.
Yeah.
Yeah.
Now, I would say we have about 2 more minutes. So,
I don't see her, but she's not
I got
telling
that
us.
3. What was the last thing that you put on me? Was that
I put actually a tinted SPF from Aven. It's a 50.
Okay.
It's got some micronized zinc oxide in it, which is great because I always say the UVB rays are the burn, the UVA rays are the always. And you want to make sure you're putting on something. That's why I really love makeup and the compact makeups that have SPF like 25. So you've done your due diligence in the morning. You've put on your SPF 40 or 50. Nothing under a 30, folks. And then you've moved up to, now I'm putting my makeup on. Well, you have your compact in your car or in your purse. Reapplying some makeup during the day, don't forget, is reapplying your SPF and your protection.
Nice.
And don't forget the backs of your hands, because when you're doing all this lovely things on your face and neck and chest, you still have some product left on the backs of on your hands. So go ahead, don't wipe it on your butt or on your toes. Wipe it on the backs of the hands so that this matches that, because age shows up a lot in the hands. Yeah, we wouldn't hide those bad boys. But if you do the right things, your hands will look just as great as your face.
Excellent.
Yeah.
Excellent. So now that I've got a high gloss shine.
Yeah, she's totally glowing. That'll calm down in the next couple of minutes. It's just fresh out. You're fresh out of the oven.
But it feels good. So we've got 1 more minute, and I would just like to thank you, Shawn, so much.
Thank you for having me.
Yes.
It was great.
Shawn Wiesen, and what's the company? The
Mainline Institute of Plastic Surgery.
Yes.
We're at Lankenau Hospital. We're in Medical Office Building East, number 660.
Nice.
And Dr. Hoffman is absolutely amazing. I encourage you to come in and meet the staff and come see me. Come see me as your medical esthetician. I'd love to treat your skin.
And thank you for joining us on Radnor Studio 21
Thank you for having me. Thank you for having me.
My pleasure. And if you'd like to email us maybe with any comments. Of course, keep them very decent, please. And don't be obnoxious, because they'll just get deleted. You can email us at rstudio21 at, oh God, I forgot, gmail.com.
We got through it.
So thank you. Thanks for joining us.